The name of this course is the AASLD ILTS Liver Transplant Course. Transplant course is an annual occurrence at the AASLD meeting designed to engage fellows, junior faculty in the current events in transplantation. And the overview for this year's course is really based upon catalysts for innovation in the next 10 years. The mission behind this course is to provide a foundation for junior faculty, fellows, and trainees as to the current areas of interest and the future areas of development in liver transplantation.
This year is very interesting. The topic's very interesting. It's very atypical from what we had before. What I learned from today is more, maybe we should rethink the whole transplant map and about how we can do this better and really open up different options.
It seems that we're looking now, basically, there's a shortage of organs for liver transplant, and the meeting of this course is looking at how to expand the pool of donors to supply, the high demand for organs.
We're going to rethink about our strategy of how we can start and transplant more and more people with safety of the donors. It's very important. The donors should be very safe when we transplant them in the live donor transplants, which is very important. And we have seen the data that in US we need to do it more and more so that it's helpful for more and more patients. We have a lot of liver disease patients right now.
Service at Yale, we focus mostly on the pre-transplant patient. So I work a lot with the end-stage liver disease in getting them prepared for the liver transplant. And one thing that I'm taking away from here is the changes that we're now having to focus on for specifically portal pulmonary hypertension and the lower percentage of arterial PO2. So when we're looking at our patients, we can now focus on specific parameters and ideally seek those exception points for the appropriate people.
Our hope for the attendees from this course is not only that they have a good educational foundation as to what the current areas are of controversy and a potential discovery, but where those new areas may be evolving in the next decade.